Well, let's return our attention now to more serious matters. This week, a CBC News investigation, as I mentioned, did find that a private foster home operator gave cannabis to kids in its care. Spirit Rising House gave some of its foster kids in care marijuana daily as a form, they say, of harm reduction. The province launched its own investigation. They say they would no longer place kids in child and family services there, and youth would be transitioned out of its homes over the next couple of months. But this leads us to a bit of a bigger conversation about the relationship between cannabis and harm reduction in youth, and also what we understand now about cannabis and its effects on youth and on all of our brains. Dr. Jennifer Anderson is a family doctor. Now, she specializes in cannabinoid medicine for both adults and pediatrics is her field, and she's with us via Zoom. Thank you so much for being here.
Thank you so much for having me.
So let's start with your reaction to this story, the local foster home giving marijuana to kids daily as a form of harm reduction. What did you think when you heard this?
My initial reaction, was that this is obviously illegal. In Canada, it is absolutely illegal to be giving any form of cannabis to anybody in pediatrics. And, I've been looking after kids with using cannabis for different reasons, mostly being epilepsy, cancer, and different things that are very hard to treat. And, it is very common for people to be thinking that it's recreationally legal for everybody. Unfortunately, I think the message is not super clear for a lot of the families that I see, even the doctors that I interact with, and I do think, however, in these sorts of fields, it is pretty clear when you're working with kids in care what substance use is and what is legal and what isn't. So it's hard to say whether or not there was, it was unclear, but in Canada, this is obviously illegal to do.
Just to broaden the conversation out from the specifics of this case and the legalities, I'm curious about cannabis as a form of harm reduction for kids. So you mentioned as a form of you use it. You mentioned in epilepsy was your example. So physical things that are going on with kids' health. But what are your thoughts on it as a form of harm reduction?
That's a really interesting conversation. At this point, we are in healthcare looking for ways to help with harm reduction. There's a lot of literature. Even I was just looking last night to see what is the literature on harm reduction. It's very obvious that there's a huge need for implementation of harm reduction strategies. There are numerous reports, even in Manitoba, that have advocated for this with no real response. When I go about my practice, I would say over 50% of teens are using cannabis, and that I think isn't a common knowledge, but just working with teens, I know a lot of teens and it's everywhere. I also work full-time in an emergency department. I work a bit in the city in urgent care, and substances are everywhere in this age group. And, I think it needs to be addressed because I understand where they're coming from. These kids are accessing cannabis on the street, which is now being laced with other medications, fentanyl, sufentanil, new things we've never heard of, and it's super dangerous. So I understand where they're coming from. It is a very big area that needs to be addressed, and there needs to be some way to navigate harm reduction strategies, and that just doesn't exist. I did speak with a few of my friends who are in this industry, and they don't feel that they are well supported to help with this, and it is such a big issue. Trauma-informed care is a huge thing right now, and trauma-informed education in this area would make such a big difference.
It's interesting because I know that when cannabis became legal, we did a series of deep interviews, and the research at that time even was still sort of young, as you said. But there's so much more research to be done. What do we understand and know about the dangers of a young person taking marijuana? And then I'm curious because if it is used in practice for physical ailments for kids and it's showing promise, how do you walk that line, thinking about the effect it could have on their brains?
That's a really good question. So when we think about marijuana or cannabis, we think about smoking it. There are lots of different forms of cannabis, and it's made of a lot of different cannabinoids. There's actually over 100 different cannabinoids in the plant, and you can work with the plant in many different ways to extract different ones. There's also other non-cannabinoids ingredients that really help it to work in different ways. So when we're talking about using it for various things. If we're using it, for example, in epilepsy, we're using a non-psychoactive component in the form of an oil, put into the form of an oil that we're administering orally. And this is very different than, a child or a teen going onto the street and picking up, cannabis and smoking it. The research, up till really recently actually was done on recreational cannabis that was used and like in history, and looking at retrospective studies. We are just starting to do a lot of research on kids now, looking proactively and looking at what happens when you do use cannabis to treat many different things. There's actually a study that just launched called the Real World Evidence on Medical Cannabis in Pediatrics, called the CAN-RWE study, that is being done here. I think Dr. Lauren Kelly is one of the main researchers in this study, looking at pediatric patients across Canada using cannabis for various medical reasons, and following them to look at the safety and the benefits of that. And I think that will be a lot more informative than the studies that we have to date. But we have to keep in mind that when we're talking about cannabis, we have to be specific. We have to say, what form are we using and what is it? So are we using THC products and smoking it? Are we using CBD products in an oil? We need to specify that when we're talking about the long-term benefits and safety risk.
And sort of to build on that a little bit, as a doctor, what do you do if an adult comes to you with concerns about a youth being addicted to cannabis, or they still hold in their mind that somehow this is a quote unquote gateway drug? And I hate using that term, but I mean, there are people that are still new to understanding cannabis, even though it has been legalized now and we're learning more. How do you address those questions?
So I get a lot of teens referred to me, or doctors reaching out to talk to me about how to deal with teens in their practice that are using. My approach has evolved over the years, because what I have seen in the ER, in my own personal practice, but also like just in the community, is that substance use stems from some form of trauma, and when we're talking about teens, especially in the last 5 years, a lot of them have not been well equipped to deal with whatever type of trauma they've dealt with. And that can be emotional, mental, physical, or combination. And when we're talking about kids in care, this becomes very important. And so my approach has been actually to encourage discussion around the reason why teens are using. What I have found when I talk to teens is that they actually many times are using cannabis medicinally. And what I mean by that is kids will often say, you know what, I get so stressed going to math class, and then I go and I smoke marijuana, and then I feel better and I go to math class. or my ADHD is just, so out of control despite the medications I'm on. But when I go and I smoke marijuana, I can calm down and I can function. So that to me is medicating. And so a lot of the discussions I have are around that and trying to figure out other ways of coping. Because if we can teach kids to figure out why they're doing it and be more intentional about their use of anything, including pharmaceutical drugs, or even just, going and, shopping and doing things that are somehow medicating themselves, then they're going to stop and pause, hopefully, when somebody offers them something else like meth.
And these are conversations. Obviously, we've just touched the tip of the iceberg here in a conversation. I really appreciated speaking with you. I hope you come back on the show. Thank you very much.
Thanks.
Via Zoom this morning, Dr. Jennifer Anderson, a family doctor who specializes in cannabinoid medicine for both adults and it works in pediatrics as well.